Hi, my name is Chippy Nalluri. I'm a cardiologist at Sarasota Memorial Hospital, and I'm here today to answer questions about women's heart health.
Thank you for speaking with us today, Dr. Nalluri. Can you please explain how women's heart disease differs from heart disease in men?
By the time a woman presents with heart disease, in general she's 10 years older than a man. Therefore, when she presents with her first heart attack, not only is she older, but she has greater comorbidities, meaning she's been a diabetic for longer, she's had high blood pressure for longer, has been battling high cholesterol. She could have other disease processes such as kidney disease present for longer. Therefore, the heart attack just doesn't become a heart attack. There are complications that can occur because she has other disease processes that are in full swing. Women tend to have a greater risk of heart failure and arrhythmia than having just a heart attack.
Thank you. What are the symptoms of heart disease that women should look for?
So previously we used to make a big differential between symptoms a woman feels and what a man feels. But what we are finding is women have very much the typical symptoms we talk about regarding heart disease. She can come in with substernal chest pressure, pain, discomfort. It can radiate into her arms, up her neck, through the back. She can break out into a sweat, get lightheaded, dizzy, similar symptoms. And again, these symptoms could be brought on with exertion. However, what we're finding is women tend to have these symptoms at rest. It can wake them up from sleep, or it could be precipitated by an intense emotion, such as a very difficult emotional stress.
What factors can put women at higher risk of developing heart disease, and what can we do to reduce our risk?
So the factors that lead to heart disease in women, similar to factors that lead to heart disease in men. The very typical factors that we see very commonly: smoking, diabetes, high blood pressure, high cholesterol, certain inflammatory disease processes, having chronic kidney disease, and importantly, poor physical activity, poor function, poor nutrition are all contributing factors for heart disease. What can we do? Fortunately, 90% of heart disease can be prevented with changing modifiable risk factors, meaning you could stop smoking. With diabetes, we are finding that so much of diabetes can be dramatically improved or even resolved with lifestyle changes. You can control your blood pressure, you can control your cholesterol, again, through diet, physical activity, stress management. So when we talk about what can we do to reduce the risk, there's actually 4 pillars. One is food. Nutrition is extremely important to not just heart disease, but what we are finding, disease of affluence, disease of the modern man. Physical activity, fundamentally important to reduce all traditional risk factors for heart disease. Also, stress management. So practicing something throughout the day that reduces your level of stress. We are finding that stress is an underlying cause for so many disease processes. And the 4th is to have love. Love and social connection we are finding to be exceptionally important. So when you put these 4 modifiable things together in a person's life, you can dramatically reduce heart disease and, again, many chronic illnesses.
Thank you. When should a patient consider minimally invasive surgery instead of a traditional open heart procedure?
So minimally invasive surgery, to define it, it is a surgery that is typically done through the rib cage. Generally, the incision is anywhere from 2 to 4 inches in size versus the traditional median sternotomy, or cutting the breastbone, which is anywhere from 6 to 8 inches or 10 inches in length. With minimally invasive surgery, there is a faster recovery, less pain, you can return to your normal activity quicker. And for young women especially, we consider this option obviously for cosmetic reasons. But for an individual to have minimally invasive surgery, there has to be specific criteria. Usually it's an isolated mitral valve surgery or possibly 2 valve surgeries, or it's a tricuspid valve surgery or aortic valve surgery. Generally, if it's a very complex, complicated surgery, or if we're doing a redo surgery, that is generally not an option.
And which women's heart health resources do you recommend?
So the American Heart Association, the CDC, these are all traditional places that people can go to. I personally love 2 sites. One is called the Physicians Committee for Responsible Medicine, PCRM.org, and the second site that I love is called nutritionfacts.org. Great resources for anybody.
Thank you so much for your time today, Dr. Nalluri. We've learned so much.
Thank you.